Over the 30 or more years that we've had a partnership with GSK, with over £20 million invested in this partnership across East, Central Africa, and also across the African continent, we have been able to develop good contextual innovation. For example, the FACE program, which is the Personal Hygiene and Sanitation Education, which was a program that was impacting sanitation and hygiene education to young school-going children. And over 1.5 million of them were trained, reaching about 6 million people because the children then influenced their families. And this project was so successful that it was actually adopted in over 16 countries in Africa and also outside the continent. Beyond this, with this GSK partnership, we've developed programs on controlling infectious diseases, looking at non-communicable diseases, expanding capacity for training health workers, not only in their skills, but also in leadership, management and governance, and also in developing capacity to run health systems.
Through the many training with Amref-GSK program, like the CHV training, the middle level healthcare worker training, the leadership and governor training, and the mentorship training, we have discovered that there were a lot of changes in our system, in our what we call patient outcome management.
I am a beneficiary of Amref, and we had a training for quite a time where we were trained on face-to-face, that is in class, on diabetes and asthma. We were also trained on M-learning, and M-learning was actually using a phone to contact your client and your supervisor.
The training has been very key for us as county managers when we are looking at issues of implementing non-communicable diseases, because we have been able to do mentorship to our middle healthcare workers at facility level. We have been able to do capacity building for community volunteers who are the key mobilizers at household level on issues of non-communicable diseases. We have gone ahead and looked at the data that we generated before we were trained and after we have been trained. And I want to report that we have had a very impressive data that actually we used to discuss, dialogue, assess, and it informed the county health management team to discuss and agree that we need to factor a budget into our operational budget at the county on issues of NCDs.
What inspired our partnership 30 years ago was to collaborate on preventing malaria. And we funded a program to support the distribution of bed nets. Our partnership with Amref is that they are the go-to organisation whenever we want to start anything new. And what I love about Amref is that it is so community-based. So when we start projects, it starts with the community. So we kind of think, oh, well, when are we going to get some results? And the results actually are very early on, because it is around focusing on what people can do to make their lives healthier.
This has been a truly impactful partnership, and this is going to be a truly impactful partnership into the next century. We truly thank GSK for believing in us as a partner of choice for this region in the continent, and we look forward to even more.
Just thank you, Amref, for being such a great partner. And yeah, we hope that there is more that we can do together on our new strategy.